What happens if your PSA comes back at 6? What about 30 or 500? For most men, the moment they see the number in tens or hundreds, their brain goes straight to panic. My name's Dr. Chovanec, and as an oncologist, I read PSA numbers differently. Because PSA, it's not a diagnosis, it's a signal. In this video, I'm going to show you what PSA of 5 really means compared to 50, what extreme numbers really mean, and the strategy doctors use to interpret your lab sheet without guessing and without panic. And by the end, you'll know what to do when your PSA is mildly elevated or terrifyingly high. Let's get one thing straight, PSA is made of prostate, not exclusively by prostate cancer. So why does it show up in your blood? Because if prostate is irritated, enlarged, inflamed, or damaged, the PSA leaks into the bloodstream. The PSA is like a check engine light. It doesn't tell you what's broken, it tells you something needs attention. That's why a PSA of 7 can mean early prostate cancer, but it also can mean it's inflammation, enlarged prostate, or something temporary. Here's a simple mental math. It's not perfect, but it helps. 4 to 10, the gray zone. Common, confusing, it needs context. 10 to 20 is high concern. We move faster with smarter testing. 20 to 50 is very concerning. We are going for expedited workup. Over 50, we need urgent evaluation. We assume there is a disease until proven otherwise. And remember, context matters. PSA of 4 at 45 is not the same as PSA of 4 at 75. Let's start with the most common situation, PSA between 4 and 10, the gray zone. This is where the most men get stuck. They're told it's high, but they are not told what to do with the information. The reality is in the gray zone, PSA can be coming from benign prostatic hyperplasia, that means enlarged prostate. It can come from prostatitis, which is inflamed prostate, or cancer. And I want to show you one simple data point that puts things into perspective. A classic summary from European urology says that if PSA is between 4 to 10, the risk of prostate cancer is between 22 to 27%, not 0. A meaningful risk, but also a high chance a lot of men in this range will not have cancer. If you're watching this because you are holding your PSA result in your hand, here is a practical plan. First, don't self-diagnose off one number. If this is new elevation, the first move is to repeat PSA under clean conditions. Second, check the symptom story. Fever, chills, pelvic pain, burning during the urination, those point toward infection or inflammation and need evaluation. Third, ask the one key question, is this rising over time? Is there any trend that PSA is going up? The trend matters more than a single number. And fourth, if PSA is clearly high or rising, you want a structured workup, often requiring MRI before biopsy, so you are not getting lost in a random needles. 3 common things that can push PSA up: inflammation or infection, urinary symptoms or procedures like catheter, cystoscopy, biopsy, some heavy manipulation, in some men, recent ejaculation or cycling close to the blood draw. This is exactly why repeating the test properly matters. Now let's talk about the numbers that trigger real fear: 30, 80, 200, 500 or more. As PSA climbs into tens or even beyond, the chances of clinically significant prostate cancers are getting higher. We move faster, but I need you to hear this clearly. Even a very high PSA is not a diagnosis. It is a signal and very loud one. There are a few important exceptions that cause dramatic PSA spikes. Exception 1 is severe acute prostatitis. A serious bacterial infection in prostate can cause a massive spike of PSA temporarily. But severe acute prostatitis does not hide. Men often feel sick with fever, chills, acute pelvic pain, and painful urination. And this is solved by antibiotics. Exception number 2 is urinary retention or recent manipulation. What I mean by that is when you are unable to pee and you get a catheter, or a doctor does a cystoscopy, so putting a scope inside the urinary bladder, looking inside with a camera, all this can temporarily rise PSA. And here we are again with a practical rule. If you have a strong infection symptoms and your PSA is higher, treat the cause and then recheck. If you feel fine and your PSA extremely high, this is a red flag that needs urgent evaluation. And just to show you how wild inflammation can be, there are rare case reports that show that acute prostatitis can raise PSA into hundreds or even thousands. However, this is something very uncommon and it's not for you to assume, but this proves the point that PSA is the signal and the context matters. Now here's the key reason we do not diagnose metastatic prostate cancer from single number. A large population study from Sweden looked at PSA and Gleason score. Gleason score is a number that pathologist gives to the cancer according to how it looks under the microscope, and showed what clinicians see in real life. The proportion of metastatic disease rises with higher PSA, but there is a no PSA cutoff which tells you who is metastatic and who is not. That is exactly why we use imaging studies when clinical picture is concerning. Distinguishing between localized and metastatic prostate cancer spreading throughout the body completely changes the management and prognosis of patients. Now, I don't want you to get unnecessarily scared. Even patients with metastatic prostate cancer can live a long life with good quality. Now, what doctors do if PSA is very high and there is no obvious infection story or other cause? We usually do two things in parallel. One, we confirm the clinical picture with symptoms, lab results, and imaging studies. Two, the stage we look for where the disease may be, because treatment decisions depend on that. That doesn't mean panic. That means we switch from screening mode to diagnostic mode and planning. PSA moves for three main reasons: the size, enlarged prostate, benign prostatic hyperplasia; second, infection or inflammation that causes leakage of PSA into the bloodstream; and third, cancer. The most dangerous mistake is extreme, pushing, panic, or rushing into the wrong procedure, or denial and doing nothing. The right move is strategy, repeat, context, imaging, and correct sequence. If this video gave you clarity, like and subscribe. Now that you understand what PSA numbers really mean, it's time for the most important step: what to do next. In the next video, I'm going to walk you through exact step-by-step sequence I would do if I would find my own PSA rising. So you don't get trapped in unnecessary procedures and you don't miss anything important. I'm Dr. Chovanec. Keep your health in your hands.